Now, we get on to the other part of the programme, which is to continue. It's about patient safety and it's about whistleblowing. And you now can use the word whistleblowing, which is attached, unfortunately, it's rather derogative, but we haven't got a better one, because that's what this is really about, because we think it influences patient safety as well as doctors' lives. One of the things is what happens to patients if a good practitioner is withdrawn from them by the managerial system. What happens? Is harm done to them? You would expect it. Yes, they may have to wait twice as long in outpatients, but what happens actually in terms of harm you can count? This is extremely difficult to find out. And David went off to the Department of Stealth and he asked them the question when he was interviewing. What about harm to patients and what about... They had no idea. They had no statistics related to this. And he may speak later in the afternoon session. So with some difficulty, we found someone who had been harmed by whistleblowing. I call on my dear colleague, Wim Blanke, Dr. Wim Blanke, ex-consultant anaesthetist from a trust, North Bristol. And he has a story to tell.
Thank you. I put the clock on because it might be useful. Okay, the baby who asked for a change. I hope that already more people are asking for that. Again, George Orwell, the further society drifts from the truth, the more it will hate those who speak it. So to talk, you have to provide courage, you provide sacrifice, but nevertheless, we hope that we can do better. And I just want to ask you to pay respect for the people involved. Just an example, Jenny Vaughan, a colleague neurologist who unfortunately died on the 31st of March after a long battle. But I'm 100% certain as a clinician that her cancer would definitely have been influenced by her lifelong attempts to get colleagues out of jail and avoid other people, other colleagues to go to jail. What I'm saying looks like a conspiracy. No, this is all the truth. So thank you, Jenny, for that. And her slogan was always learn, not blame. Sacrifice, we know, and there's just an example, between 2004, 2012, 96 doctors died facing a GMC investigation. If that's not enough just to cause a proper investigation, I don't know it. Hope. The Countess of Chester Hospital consultants, they were ruined. They had to apologize to a murderer as a result of that, because the management ignored the warnings. More babies died after the warnings. It is only because you have what I call a feeding ground of ignoring warnings that psychopaths can come along and do what they want, decide about life and death. I think that should be left to other people. Yes, I have a conflict of interest. I'm an now retired, forced retired consultant anaesthetist and senior clinical lecturer as a result of an accident where I tried to save my patient from exactly the harm for which I had been warning the trust in 2012, 2013, 2014, 2015, 2016, 2018 and 2019. My accident happened in 2020. The person who was 100% so say working with me to get faulty patient trolleys changed, and I submitted 4 business cases, 2 of them 0 cost for the trust management. Nevertheless, they were ignored. The person who I worked with and I thought I trusted was after the accident appointed as chief accident investigator. She closed the whole investigation without any report. Today, nothing has been investigated by my trust. There is no root cause analysis whatsoever. Even the patient who was involved, to my knowledge, has never been informed what happened to her. Why? Because I had just started anesthetizing her. She was unconscious. She was even not breathing. With my trauma, I had to continue almost rescuing her by putting an airway in because she was not breathing. Nevertheless, I had to continue. And I don't call myself a hero. I'm here because I hope that if we can avoid one more patient to happen the same, I will be very pleased. Lucky enough, the National Freedom to Speak Up Guardian said, it's not a conflict of interest for you, Wim, it's actually an interest that I have, and indeed I have that. You can read about my whole story because Ryan Prosser, and I'm very pleased to see Ryan in the audience, he made a fantastic article. Everything is 100% correct in that article. You see the trolley, that trolley went missing. First they tampered with it, and then it went missing, and most likely has been sold by the trust to an auction site. This was part of the audit that I got out of all my attempts to get the trolleys changed, which showed we didn't even know how many trolleys there were, patient theatre trolleys. 2 engineers spent 2 days in the trust and found eventually 52 trolleys, the same as the number of weeks in a year. That made it easy for my business case because I could prove that by having new trolleys, we could change all trolleys in 1 year. And that was in 2014. And then if you see those results, so they categorized the 52 trolleys, and maybe you can't read it, but the 2 bottom parts, C and F. C is stretcher requires repair and may need replacing, is not ideal for the departmental needs, or even worse, stretcher requires major repair and or is past lifespan and should be replaced. The trolley that caused my accident was 20 years old and was replaced by non-genuine parts or serviced, so to say, by somebody outside the trust. If you then take those 2 categories together, you come to 61% of all trolleys were condemned. Nevertheless, nothing was done about it. I've seen the current, so to say, retrospective records by the engineers, and it says, we looked at it, it looked fine, we've changed the struts, but we think that was not the cause of the accident. Stop, that's it. Never tested on patient weight-bearing capacity. There are plenty of organizations who deal with patient safety, also say advocates. I think just the fact of having that plethora is enough to say probably A doesn't know what B is doing. Just the National Guardian's Office for the Freedom to Speak Up project, they got 2 years ago in 2022, 25,000 calls in 1 year. 25,000 calls. We can assume that several people have phoned more than once, but we can also ask, why did they have to phone more than once? Is it such a small problem if so many people find it important to ring? And what we do is we organize conferences, I hope not like this one, where everybody comes with their story and everybody says at the end of the day, this was fantastic. We've again been admiring the problem, and we go away and we say it's awful and we don't do anything about it. I'm determined that something is done about this. This page is unintentionally left blank. Why? As Salam has already alluded to, very simple, no data available, proper data. Now we have for the first time proper data thanks to the Daily Telegraph, because they have spent a lot of time analysing questionnaires. And we can't use it as an excuse to say, oh, we can't do anything because we don't have any data. What we have is the outcomes. We know what people have been doing. We know what the result is. We know their trauma and damage. Just to quote one of the directors in my trust in the past, when a colleague asked about her critical incident report why there was no follow-up, the answer was, oh, I throw them in the bin. I get so many critical incident reports that I can't deal with them. The trust has an obligatory statutory duty of candor. We as doctors, clinicians, healthcare professionals, we have a moral duty of candor to tell the patient what happened, what we've done about it, and how can we prevent it in future. That is whistleblowing. Today, my trust probably has never spoken to the patient. She probably doesn't know what happened to her. One other chief executive in the past in my trust, I was there when she said, I'm not interested in the quality of care in my trust. I'm only interested in the number of patients going through my trust. I asked during my attempts to present my business case, is it really the case that the trust waits for an accident to happen before they will do something about a trolley? There was a clear yes. Yes, that was in 2016. Just briefly to finish, we all know the system that we have to use when we have to report a critical incident of near miss, the famous DATEX system. And I don't have anything against DATEX, but maybe it might be a bit revealing if you know the background. It was actually founded successfully in 1986 by Mr. Brian Capstick. DATEX is now used amongst all of us in the trusts as a verb. I will DATEX you. That's the threat that people launch against each other. If you say that, I will DATEX you. Now, this is a structure, and I want it to be complete, so my apologies that it's so small, but I wanted to be correct. As just an example, Mr. Capstick, and I don't have anything with Mr. Capstick, I never met him, but Mr. Capstick, he founded DATEX. It's a software company, basically. But Mr. Capstick, of course, is also the founder of Capsticks, one of the biggest and probably one of the best legal firms in the country. They give also advice to NHS employers about how to deal with whistleblowers, and there is a new guidance coming out. I'm looking forward to see what's in there. Capsticks also feed all information from the NHS to the employment tribunals. The NHS is virtually not involved in that, and that's what I've seen with my case. It's taken away from the trust and going to DATEX, and DATEX is Capsticks. I'll leave it there, and you can come to the conclusions. Thank you very much.
Well,